In my speech, I will tell you the steps to take to help you identify your symptoms of anxiety and some of the short-term and long-term techniques you can use to help manage it. The first step I want to talk about is to identify your symptoms and how they affect you. Anxiety disorders are one of the most common illnesses in the United States and affect individuals of all ages. According to anxiety.org, Dr. Abigail Power states anxiety disorders are characterized by general fear or excessive anxiety that can have a negative behavioral or emotional consequence. In the same article, Dr. Veliski, an associate of Powers, covers the physical symptoms of anxiety and the effects it has on the body. Not only does it increases your chance of heart disease and diabetes, but it causes high blood pressure and generally higher cholesterol levels. This makes it important to identify what exactly your symptoms are and how anxiety is affecting your body. And if you have trouble doing this, seeing a professional can help you. Determine how your symptoms can affect your behavior. Social interactions are a good indicator if your anxiety has been affecting you, and some good indicators of that would be avoiding contact with your friends or family, and this would be considered isolating yourself. Being exhausted from dealing with anxiety every day because it gets you into arguments or just giving you a short temper in general. Some other social indicators you could find yourself doing is abusing alcohol or tobacco, or even overeating or undereating, and this could cause unhealthy, sudden weight changes. After identifying how your symptoms affect you, the next step to take is to learn some short-term solutions to help you cope with your anxiety. This brings me to my next step, which is to find ways to calm your anxiety in the moment. Using deep breath techniques will relax your body by lowering your blood pressure and heart rate. According to the peer-reviewed journal Clinical Hypertension, which was published in 2017, it has been reported that deep breathing could reduce blood pressure in general. Blood pressure is decreased by inhaling and increased by exhalation. So inhaling longer than you exhale will lower your blood pressure overall. This lowering of blood pressure is due to your blood vessels dilating, and this associates your brain with a state of relaxation, which will help decrease your heart rate and help you relax more and give you almost a feeling of calmness. Another thing you could do is distract yourself and distract your attention away from your emotions or thoughts. According to a recent article published in 2020, Dr. Katharina Starr talks about the function of distraction techniques and the different types you can use. Starr advises instead of putting all your energy into an upsetting emotion, you reset your attention to something else. When you distract yourself, you're able to manage your emotions by bringing your focus elsewhere. Some distraction techniques that Dr. Starr recommends is writing a journal or using entertainment. Writing a journal allows you to manage your thoughts on paper, which is much easier than just working it out in your head. Using entertainment like watching a movie or reading a book completely redirect your attention from anxious thoughts. You can also try meditating in the moment if you feel anxious. This will help keep your body present and focus on sensation rather than thoughts. I would like to do a quick demonstration on meditation that you can do if you're feeling anxious or if you're in an anxious situation. You can follow along if you like. Find somewhere to sit down where you feel comfortable. You can close your eyes if you like. Take a deep breath in through your nose and out through your mouth and repeat this 3 times. And then after this, allow your body to return to its normal breath. You're going to want to focus on what you're physically feeling. Feel the ground with your feet and observe your breath almost like you're an outside perspective of your body. If your mind drifts back into your thoughts, bring your focus back to physical sensation. At one point, your feelings of anxiety should calm, and if you weren't experiencing anxiety, hopefully feel a bit more relaxed. We've covered some of the short-term strategies and methods to help reduce anxiety. Next, we will talk about some long-term strategies we can use to deal with our anxiety on a daily basis. This brings me to my final point, which is to learn long-term strategies to cope with anxiety throughout your life. Creating good habits that support mental and physical health is important. Incorporating exercise and maintaining a healthy diet in daily routines is a good way to reduce anxiety. According to the article published in 2019, Can Exercise Help Treat Anxiety by Dr. Radley of Harvard Med, getting your heart rate up changes brain chemistry, increasing the availability of important anti-anxiety neurochemicals including serotonin and endocannabinoids. On the other hand, your diet is important as certain foods can help reduce your anxieties and others can actually cause it. Food high in antioxidants like berries, beets, and gingers are correlated with lower levels of anxiety, but in addition to that, alcohol and caffeine are known to aggravate symptoms of anxiety, and it's best to avoid those. Different types of teas and vitamins are known to help reduce anxiety, including green tea and chamomile tea. Including this in your daily routine can have some positive effects in reducing anxiety. Green tea contains the amino acid L-theanine, which relieves stress and reduces blood pressure, similar to how deep breathing affects your body. According to a study done at the University of Pennsylvania Medical Center, patients with generalized anxiety disorder took chamomile supplements for 8 weeks, and it showed a significant decrease in anxiety symptoms compared to those with patients taking placebo. Identify what triggers your anxiety and find ways to manage them in real life scenarios. There can be a number of things that can trigger your anxiety, and it could be anything from smoking cigarettes to something more like a complex like a relationship or something with a work environment. Some common triggers that could be in your everyday life would be phobias and fears such as crowded places like classrooms or stadiums. And when you do figure these triggers out, it is best to limit your exposure to them. Another thing you could do is to learn alternative ways of thinking in anxious situations to avoid negative thought patterns. These alternative ways of thinking help your reactions to anxiety-causing scenarios, and this is one thing a therapist can help you with. Using cognitive behavioral therapy, or CBT, you can avoid negative thought patterns. CBT has shown to be effective with depression, anxiety, and other severe mental illnesses. According to the National Institute of Health, a study shows that CBT is an effective treatment for anxiety disorder, and CBT had a large effect on reducing anxiety symptoms. The conclusion to this study states, cognitive behavioral therapy for anxiety disorders is moderately effective for improving quality of life, especially in physical and psychological domains. Controlling negative thought patterns can help stop your anxiety from getting any worse or from even happening at all. Stressing about things that you can't control is futile and exhausting, and that's why avoiding those kinds of thoughts can be helpful.